Welcome, ladies and gentlemen. This is Dr. Haring Tibo, live on my health tips or health talk program online. Today, I'll be talking about recovery rates. This video is dedicated to most persons who are already on treatment and those who are already done with their treatment and those as well who are hospitalized. There is a conception most people think that everybody who takes treatment in all medical facilities need to recover. Yes, it's right, it's true that we should think positive because your thoughts contribute greatly in your recovery. Now, I want to address the aspect of us not understanding why some patients don't recover the same rate with others who have similar problems or go to different hospitals. I've had a series of questions in some of my videos from viewers that why is it that 4 or 5 persons will go to a hospital for malaria and they will come out with some not being very well or some not properly treated. The treatment does not come from the medical facility nor the medical practitioner alone himself nor the facility. There are a lot of contributing factors that play a major role in getting wellness. If you are not well or you are sick, put it that way for a common understanding, when you get hospitalized or you get to see a medical practitioner or you consult in a hospital or medical facility, there might be a prescription that's made to you or you might be kept on the sick bed for observation and follow-up, considered to be hospitalization. Now, there are so many factors that can cause some persons to delay, irrespective of the diagnosis made by the medic. Somebody can have malaria just like you do, and you will not come out at the same time because probably the person is not having just malaria. Maybe the person has acute malaria, and that had caused anemic condition. That means blood has gone low, and the blood percentage have reduced. In such a case, the doctor will try to stabilize the blood percentage of this patient. Meanwhile, probably you came when your own stage of malaria was not that very acute. It was not too serious or severe like the person who came earlier. You will be given medications for malaria. Even if you are hospitalized, your duration will not be equivalent to that of the other patients. So those are some of the factors. That's just one among many. Another factor could be that the form of treatment you are receiving. Somebody will get medications from a medical facility. Some will buy drugs from a road vendor. You don't know the credibility of the drugs, the quality of the medications. Is it the one that is supervised by an authorized censor commission or organization? So we have to take all those aspects into consideration. Another factor is your psychology. Yes, you are also going to play a major role as a patient to see that you get well. Your wellness also count on you greatly because your psychology, what you are thinking, has a major role to play with your wellness. Your thoughts affect your body metabolism. What you think affects everything, how your body works. Just take this simple scenario. If somebody is doing like omelette, like frying egg across your neighborhood, and you perceive the aroma of egg, sometimes, most often, you feel that there's some noise that comes out, sound that comes from your abdomen. Your stomach makes some noise. Yeah, you get some noise from there. It's because you have already perceived chemicals have already come to your nostrils, and the brain has been related to the brain. The brain interprets and discharge messages within your nervous system, which will get to those organs that are related to digestion. Is it because you ate the food? No, it's your thoughts that have made you, and probably you will feel like salivating, feel like eating egg, feel like hungry because you perceive the aroma of the egg. This means that what? When you are sick, you think you are getting well, it facilitates what it takes for you to get well. The process in your system, in your body, that makes you get well, the medications acting on, if it's malaria, you have to act on plasmodium to kill what is causing you to be sick of malaria. That process will be faster when you think that it will be faster. But when you are sick of malaria, you think that is juju. You know that the medication they are giving you in that hospital, You think that you are sick of witchcraft because one of your aunts or your old aged relative visited you and you had some misunderstanding. You think that is juju. You'll be hoping for a pastor, probably your parents or your guardian. They are interested in a medical procedure. The wellness will be retarded. Your recovery will be slowed down because your mindset is different. So we call that in science psychology. It's being tempered by yourself. So we should always think positive. Positive thinking is necessary for wellness. So those are also, that's another contributing factor for you to get well when you are sick. Some other aspects includes like alcohol. You take drugs, they tell you that take medications without alcohol. Sometimes they tell you don't take this medication with meals, you take this one before or after meals. All those instructions by a medical expert, they are very essential, so we should take them seriously. Another important aspect for recovery, for those of you who are in the hospital hoping to get well or who are suffering from some health challenges that you take treatment regularly, you need to know that rest is essential. Good dieting is very important. You can't be taking medication and you are eating the same meal, which is imbalanced diet. It's not balanced. You have to make sure you get balanced diet. You have to make sure you follow your doctor's advice. All that contributes to wellness. Sleep is vital. Rest is essential. We have observed, I personally have observed, that there are cases where somebody will not have sufficient rest. It affects you, especially like blood pressure. It affects your body weight. You put on more weight when you don't sleep well. You have a lot of depression. It affects your psychology. It retards recovery. So let's try to take a consideration of our habits when it comes to treatment procedure. Whether you are in the hospital or you are at home or you are receiving care or follow up by a medical personnel, irrespective of which facility you are attending your treatment with. So thank you for watching my video. If you benefited from this video, please share with your friends and relatives, and don't forget to give a thumb up, and also subscribe to the channel for you to have access to future videos. Bye bye and have a nice day.